Go.
Okay. Hello? Does anybody know what this number is? Yes?
120 over 80.
Okay. What does that represent?
Blood pressure.
That blood pressure. That is correct. That's what normal blood pressure is, according to the American Heart Association, the Mayo Clinic, and our government. You're all here to learn how to take your blood pressure. That's what I'm going to teach you. Okay? You only need a couple things to do that. And that would be a stethoscope and we call a sphygmomanometer. Okay? So I'm going to show you how to use this. Before you use it, everyone should know where you're going to use it on your body. Normally that would normally be on your arm, okay? Clinical people, they can use it on a leg, your knee, in case you can't get blood pressure on your arm. Okay? In your body you have what we call artery places where we can find our heartbeat. Okay? We would start, one is in your neck, that's called your carotid. Okay? You can feel that by taking two fingers and putting them up around your throat, but you don't want to use two hands because you can pass out. You have a brachial, you have a radial, you have a femoral, you have a radial, you have a tibial, and you have a pedal. A blood pressure cuff is used mainly on your brachial. I'm going to show you how to do that. First, you acquire a cuff. You can acquire a cuff at a drugstore, CVS, wherever you like to go. They have manual cuffs, they have electric cuffs. I recommend a manual cuff because if you are using one electronic, it breaks, what do? And you're going to trust your numbers if you can hear it yourself. Okay? And that's what we're going to show you. Okay? Here's your cuff. This is what it looks like. It's got a meter on it. Okay? It has an arrow on it that says,
I gotta go home.
this one
In
says,
the middle.
this one here, it says artery. And that's what you want to place it over.
There.
So you want to find your artery in your arm. As soon as you find it, you'll feel little beats in there. You put the arrow on top of it. You wrap it around.
5 or 6 tails over there.
You take your stethoscope. Those who are not used to using one, the ears, or the ends where you put in your ears, they must be going facing
And
in.
I go down there.
Okay, so you can hear. You put it on.
Yeah.
Check to see if you can hear with it. Tap the bottom. If you don't get a loud tap, you turn it. A lot of times, if you can't hear your blood pressure, that's because it's not turned and you can't hear it. Okay? So you put it on for ears. Bring your cuff up. Make sure your arrow's over your artery. Take your piece here, place it over top. Let's just sit for a minute.
Me? Where's mine?
I'm going to blow it up. On the end of this, it has a pump
Well, I gotta go home.
with a turn piece on it. You'll have to turn it to get it to hold the air in as you pump it up. I would suggest pumping it up to the parameters of about 180. Once you've got it up there, you release it very slowly. And the thing that you're listening for is the first heartbeat. And you keep listening to the last heartbeat. And after you've heard that, it takes a trial and error to practice to listen for it. The first heartbeat is your systolic pressure. That's the pressure of the blood being forced out of the heart into the vessels. The bottom number, which is your diastolic, is the fluid resting, when your heart is at rest. Is the pressure.
Who's that guy?
And once you're done, most people usually keep a record of their blood pressure. You can have any type of monitoring, record keeping of some sort of your own or from your doctor. You would keep those numbers if you're taking medication. A lot of people need to be, have to regulate their medication. And it's pretty simple procedure. Everybody should learn how to take their blood pressure. I have some extra stethoscopes and cuffs. Does anybody want to try? And I can be here to help you. Okay. There you go. Is this young lady's trying? Does anybody have any questions?
Yes.
Okay.
How do I come up with that number?
How do you come up with that number?
Yeah, how do I tell from my heartbeat, from hearing my heartbeat, how do I come up with that number 120/80?
You will read as you hear it,
When I hear that first heartbeat, I look at the dial.
and that's where you'll get your numbers from.
Okay.
That's where you'll get them. Okay. Anything else? Any questions? Okay. All right. Anyone wants to stay and practice, that's good. Other than that, have a nice night.